Thank you. You know, I would never thought in my wildest dreams that I'd be standing here today before you. I'm your roll-up-your-sleeves clinician. I work with patients every day and the top physicians in the country. But I guess when my civil liberties are being threatened and taken away from me, it's time to wake up. It's time to speak out. And I hope I don't cry. That's right, that's right.
Heaven for us.
Today is my speech is to inform you, to get you equipped to know what is really going on in healthcare and what is the truth behind it. But before I start that, let me assure you again that we are the United States of America. We have the #1 health system in the world. We are not Europeans. We don't eat like Europeans. We don't talk like Europeans. We don't work like Europeans, and our stress level is totally different than Europeans. We look at end-of-life care differently than Europeans, and if you're going to give me a European form of health care, I'm going to be really sick, because I'm not going to get the care that I have. We scream like crazy for patients. We order labs. We find what's going on with you, and we make it happen. We are aggressive here. We demand Saks Fifth Avenue value of care for target prices, and we have it here. You don't need to reform that. You don't need government to do that for you. Everything is here. Nothing is left wanting for anyone. You have to be informed, and you have to be responsible. Therefore, healthcare is not a right. It is a responsibility. You have to take care of yourself. You have to ask the questions. Look at the back of your insurance card and call customer service. Go to your human resources department and find out what you signed up for. And if you can't afford any of it, go to your Department of Human Services. They'll assign you a social worker or case manager for free to help you. I work with poor every single day. I just worked with a 75-year-old patient just the other day, and I was able to find him his medications for free. Do not tell me we don't have it. We have it. And you don't need to reform it. So let me tell you what they're saying out there. They're saying, wait a minute, this is not socialized medicine. Don't call it that. We're going to give you a health insurance exchange program where you can shop around and find what insurance plan will fit your budget. Okay, wait a minute, I don't have a degree in economics, so let me think this through with you. So you're going to make me, and they're going to mandate you to purchase insurance, by the way, or get a tax penalty of some sort. So you're going to make me pay premiums, and then you're going to take up to 50% of my income to go into this pot for public health care reform. I don't get how that's cheaper. And I don't get this exchange because we have it. It's called Call Your Local Insurance Representative. There's health plans all over the place that you can afford. Believe me. So that's not socialized. It looks very socialized to me. They talk about they want to incentivize physicians to promote quality of care and let your physician spend more time with you in your exam room and less administrative time. Let me tell you something. With your current private plan, if you get denied anything, you and your physician, or you or your physician, doesn't matter, you have the right to appeal it. 85 to 90% of the time that appeal will get reversed. With the government, you can't appeal a thing, so there goes your administrative time. You don't have to write an appeal letter. You don't have to defend anybody's diagnosis. Let me give you an example. I've been working with Medicare Part D for 3 years now. Inception came in 2006. There are 7 drug classes that are not covered. And I'll just name a few. Vitamins, cough and cold products, totally not covered for the elderly. I'm going to give you one that's an example, and don't chuckle, but it's a good example. Viagra. Yes. Viagra's not covered. Now, we know the primary purpose of Viagra, and let me tell you, the most you can get per month is 6 tablets. It's not 30, and believe me, it's plenty. But let me tell you something else. Viagra is used for pulmonary hypertension, to treat pulmonary hypertension. We have nothing to treat pulmonary hypertension. Viagra is used to treat certain prostate surgeries where men have to be on it every day for a year. With your insurance company, you can appeal that and get that approved because they know. They know that's evidence-based medicine. They know that's quality of care. Government, you're stuck having to pay for it. Now, does that make sense? I thought they're going to use evidence-based medicine. I thought they're going to promote quality. Your physicians get letters, quarterly statements from HAP, Blue Cross, Care Choices, Aetna, M-Care, it doesn't matter. Even the health system that they work in, they know how many diabetics they have, they know how many cholesterol patients they have, they know if they're not reaching their goal. And believe me, they're being forced to make sure those patients are reaching their goal, staying alive and out of the hospital. I work with asthma patients all the time. Don't let them lie to you. Quality of care is already there. We have changed over the years, and they're improving. It's a good time to be in the healthcare field. It's a good time. They tell you, but wait a minute. We want to make sure that health plans don't deny you for pre-existing conditions. Okay, that is so 80s. No one does that anymore. And if there's any health plan that does do it, it is so small and tiny, it's going to be dissolved from competition anyways. It's unethical. You can't do it.
The government will do it.
So this is the information that I have for you. Now, the current program that's being piloted is in Massachusetts. It's in its 2 years of inception. They have a 4-phase public program based on your income. I read the Board of Governors minutes just the other day, and for next year they're going to be dropping dental and vision, and they're going to try to find a way to decrease over 17,000 members. Okay, it's in 2 years of inception, you can't control your costs already? That doesn't make any sense to me. And you're going to let this be the thing that you're going to transparency all around for the next 50 states? That doesn't make any sense.
No.
We do need healthcare reform, but not by the government. We need court reform to take care of medical lawsuits. We need to be able to purchase insurances across state lines. Kaiser Permanente is a phenomenal health plan. We need to be able to purchase insurances across state lines. We need to be able to invest in our own healthcare by having a medical savings program, just like you do for your 401ks and your money market. So I leave you with information. I leave you with passion, because no one is left wanting, and don't ever forget that. Thank you.